Driving excellence through systematic quality improvement. Introduction to quality improvement. Welcome to quality improvement in healthcare. Quality improvement involves systematic approaches to enhance patient care, improve outcomes, and increase patient satisfaction. Today's learning objectives include understanding quality improvement principles and methodologies, learning the Plan Do Study Act (PDSA) cycle, identifying key performance indicators in healthcare, exploring evidence-based practice integration, engaging patients in quality improvement efforts. Quality improvement is a structured approach to enhancing patient care by improving processes, outcomes, and patient satisfaction, with nurses playing critical roles in these initiatives. Foundations of quality improvement. Quality improvement represents a systematic, data-driven approach to healthcare enhancement. Core principles. Focus on systems and processes rather than individual blame. Use data and evidence to guide improvement decisions. Involve all stakeholders in improvement efforts. Emphasize continuous rather than one-time changes. Apply scientific methods to healthcare improvement. Benefits to healthcare. Improved patient safety and outcomes. Enhanced patient satisfaction and experience. Reduced healthcare costs and waste. Increased staff satisfaction and engagement. Better organizational performance and reputation. Nurses' role in quality improvement. Identify opportunities for improvement in daily practice. Participate actively in quality improvement teams. Collect and analyze quality data. Implement evidence-based practice changes. Advocate for patient-centered improvements. Plan Do Study Act (PDSA) cycle. The PDSA cycle provides a systematic framework for testing improvements. Plan phase. Identify specific problems requiring attention. Set clear, measurable objectives for improvement. Develop detailed strategy for addressing issues. Define success measures and data collection methods. Consider potential barriers and solutions. Do phase. Implement changes on a small scale initially. Collect data systematically during implementation. Document observations and unexpected findings. Monitor for both intended and unintended consequences. Maintain detailed records of the implementation process. Study phase. Analyze collected data thoroughly. Compare actual results with predicted outcomes. Identify factors contributing to success or failure. Determine if objectives were met. Learn from both successes and setbacks. Act phase. Standardize successful changes across the organization. Abandon or modify unsuccessful interventions. Plan for widespread implementation. Monitor for sustained improvement. Begin new PDSA cycles for continuous improvement. Key performance indicators in healthcare. KPIs provide measurable ways to assess healthcare performance. Clinical outcome measures. Mortality rates for specific conditions. Hospital readmission rates within 30 days. Hospital-acquired infection rates. Medication error frequencies. Adverse event occurrences. Patient safety indicators. Falls with injury rates. Pressure ulcer incidents. Central line-associated bloodstream infections. Surgical site infection rates. Never events, preventable serious adverse events. Patient experience measures. Patient satisfaction survey scores. Net promoter scores for healthcare services. Communication effectiveness ratings. Pain management satisfaction. Discharge process satisfaction. Operational efficiency indicators. Average length of hospital stay. Emergency department wait times. Appointment availability and access. Staff turnover rates. Resource utilization rates. Cost-effectiveness measures. Financial indicators demonstrate value-based care. Cost per patient. Total cost of care per patient episode. Cost per diagnosis-related group. Medication costs per patient. Supply costs per procedure. Staff costs per patient day. Return on investment, ROI. Financial benefits compared to improvement costs. Savings achieved through quality initiatives. Revenue improvements from better outcomes. Cost avoidance through prevention. Long-term financial sustainability. Value-based metrics. Cost per quality adjusted life year. Patient satisfaction relative to costs. Clinical outcomes relative to expenses. Population health improvements per dollar spent. Preventive care cost effectiveness. Evidence-based practice integration. EBP provides the foundation for quality improvement. Guiding quality improvement initiatives. Research evidence informs improvement strategies. Clinical expertise guides implementation approaches. Patient values and preferences shape interventions. Systematic reviews provide best practice recommendations. Meta-analyses offer strength of evidence assessment. Standardizing care processes. Clinical practice guidelines ensure consistency. Protocols reduce variation in care delivery. Checklists prevent omissions and errors. Standardized procedures improve outcomes. Evidence-based policies guide decision-making. Evaluating improvement outcomes. Compare outcomes to evidence-based benchmarks. Assess interventions against research findings. Use validated measurement tools. Apply statistical methods appropriate for data. Continuously update practices based on new evidence. Patient engagement in quality improvement. Patients provide valuable perspectives for improvement efforts. Collecting patient feedback. Patient satisfaction surveys and questionnaires. Focus groups for in-depth discussions. Patient advisory councils for ongoing input. Real-time feedback systems. Social media monitoring and analysis. Involving patients in quality improvement teams. Patient representatives on improvement committees. Patient storytelling to highlight improvement needs. Patient-centered outcome measure development. Co-design of care processes with patients. Patient education and empowerment initiatives. Patient education about quality improvement. Explain quality improvement goals and methods. Share quality data and improvement progress. Encourage patient participation in safety practices. Promote understanding of evidence-based care. Support informed healthcare decision-making. Technology for patient engagement. Digital tools enhance patient involvement. Patient portals. Access to health information and test results. Secure communication with healthcare providers. Appointment scheduling and prescription refills. Educational resources and health tools. Feedback submission and satisfaction surveys. Mobile applications. Symptom tracking and monitoring tools. Medication reminders and adherence support. Health goal setting and progress tracking. Educational content and resources. Communication with care teams. Telehealth platforms. Remote consultations and follow-up care. Patient education and counseling sessions. Chronic disease management support. Medication management consultations. Mental health and wellness services. Creating a culture of quality. Successful quality improvement requires organizational commitment. Leadership support. Executive commitment to quality improvement. Resource allocation for improvement initiatives. Recognition and reward systems for quality. Clear communication of quality priorities. Accountability for quality outcomes. Staff engagement. Training and education on quality methods. Opportunities for staff input and participation. Recognition of quality improvement contributions. Time and resources for improvement activities. Psychological safety for reporting concerns. Continuous learning. Regular review of quality data and outcomes. Sharing of best practices and lessons learned. Benchmarking against high-performing organizations. Professional development in quality methods. Innovation and creativity encouragement. Quality improvement team dynamics. Effective teams drive successful improvement. Team composition. Multidisciplinary representation. Frontline staff involvement. Patient and family representatives. Quality improvement expertise. Leadership support and sponsorship. Team processes. Clear roles and responsibilities. Regular meetings and communication. Data-driven decision-making. Systematic problem-solving approaches. Documentation of decisions and actions. Team success factors. Shared vision and common goals. Trust and psychological safety. Open communication and feedback. Commitment to improvement. Celebration of successes and learning from failures. Sustaining quality improvements. Long-term success requires systematic sustainability planning. Sustainability strategies. Integration into standard operating procedures. Training and education for new staff. Ongoing monitoring and measurement. Continuous reinforcement and support. Adaptation to changing conditions. Monitoring systems. Regular data collection and analysis. Dashboard reporting for key metrics. Trend analysis and pattern recognition. Early warning systems for deterioration. Feedback loops for continuous improvement. Organizational change management. Communication of improvement successes. Policy and procedure updates. Performance measurement integration. Resource allocation for sustainability. Cultural reinforcement of quality values. Leading quality improvement excellence. Quality improvement is essential for advancing healthcare excellence. Remember, systematic approaches like PDSA cycles drive effective improvement. Key performance indicators guide data-driven decisions. Evidence-based practice provides the foundation for improvement. Patient engagement enhances relevance and effectiveness. Sustainable improvements require organizational commitment and culture change. Thank you for watching. These quality improvement skills will help you drive excellence in patient care throughout your nursing career.